News Radio 700 WLW.
She's been on our program before. We love Dr. Leann Silhan. She's with Diamond Physicians, and she's standing by right now to talk with us. Doctor, how are you on this glorious Thursday?
Oh, I'm well. Thank you, Ken.
Why do you think the spike is happening now? We were told, anecdotally, of course, that when the warm weather came, that would lessen the chance of transmitting this disease because these droplets wouldn't travel as far as they did perhaps in cold weather. Why are we spiking now?
Yeah, so, New York and the West Coast, California, Washington State saw some really high caseloads in April, March and April, really. And they took really drastic measures to control those. Places like where I live in Dallas, Texas, did a shelter in place for a short period of time, thinking that would control the small outbreaks that we were having. Yet, as soon as we start opening things back up, without all the safety measures in place yet that the CDC and CHS had recommended, I think it was unfortunately inevitable that we would start seeing a spike. Not all viruses are seasonal the way that influenza is, and I think it was unfortunately false hope that coronavirus would be expected to be. For example, rhinovirus, which is one of the viruses that causes a common cold, occurs just as commonly in the summer as it does in the winter. So not all viruses decrease in the summer weather. But
why the spike among younger people? Is it because they're less apt to wear a mask and social distance? It seems to be they were immune to this back in the early part of the corona epidemic. Why now?
Right. I think it's twofold. So one is we were all young and maybe not as cautious at one point in our lives. And so there's certainly some behavioral issues that I think are contributing to the spread of the virus amongst that age group. Secondly, I think that there was a lot of reports, early on that this virus, even if they got infected with it, it wasn't dangerous for them. And so I think there was kind of a false sense of security as well from some of the public health reports, which, is only partially true. There are some individuals, in the young age group, even if they're completely healthy, that can become quite ill from that. So I think those two things have led to the large spike in the young individuals.
Well, now we're seeing more of a push to wear masks. In fact, it may be mandated in California before this day is over that if you leave your house, you have to wear one. And I think that's not anecdotal. A mask helps, right? It helps protect others from you, but you need everybody playing this game. If it's only 99% participation, it's not going to work, right?
Yeah, that's correct. So masks do work. We know now that early on we knew surgical masks and N95 masks worked, and then we quickly found out that even homemade masks made out of fabric work some better than others, but they all prevent the spread of droplet and airborne particulate matter that contains viral particles. And if everyone participated in it, we would see the case rate go down significantly. Unfortunately, the virus is highly contagious, and even with masks, the counts are not going to go to zero, but that would significantly impact, I think, the spread at this point in time.
Another anecdote that's making its way, we're chatting with Dr. Leann Silhan from Diamond Physicians. Another anecdote that's making its way around, I don't know what the scientific basis is that if you contract coronavirus now, it will not be quite as devastating as if you did in the winter because there are more therapeutic treatments that are available now. Is there any truth to that?
No. In fact, I think that's the opposite is quite true. So the longer we can prevent the spread of the virus, the fewer people we can keep from getting it, the more likely that we'll have effective treatments as time goes on, as well as the vaccine. Vaccine development is underway, and it may be months, it may be another year before we have a vaccine available. But I believe the longer that we can keep people well, the more likely we'll have for effective treatments as well as the vaccine.
So the same disciplines, as what you're saying is, I think, the same disciplines that we had in March. Wash your hands, don't put your hands near your face, your mouth, your eyes, and wear a mask, which unfortunately has been over-politicized, I think. Wear a mask. If you adhere to the same disciplines, your chances of getting this disease are greatly diminished.
Correct, and I'll just add a couple things to that. The other is, do not gather in large crowds if at all possible. Stay home as much as possible. Obviously, if you need to work or go out for supplies and those sort of things, that's necessary. But things that are unnecessary, stay home.
Yeah. It's not going away anytime soon, is it?
That's right.
Yeah. Doctor, thank you for your time. We appreciate it. Have a great day.
Thank you, Ken. You too.
Okay.